deadlines can be a determining factor in getting things done. And there are two important cutoff dates that, if you miss them, could mean you're cut off from health insurance for the entire year. Here to explain is Doug Bennett, Director of Individual Health Plans for Medical Mutual of Ohio. Welcome to the show.
Hi, Lori. Thanks for having me. Appreciate it.
So let's talk about the details of these deadlines.
Well, there's two deadlines that are important to remember when you're considering your health insurance needs for 2016. The first one is January 15th. If you purchase a plan or make a change to your existing plan by January 15th, you'll be in good shape. The plans will start February 1st for you.
Okay.
Now the second deadline is actually January 31st. That's when open enrollment closes. We really need you to make a plan selection by that point, or make a change to your existing plan if you need to find a new fit for yourself. If you make the decision between January 16th and January 31st, those plans will become effective March 1st for you.
Okay, so what if we miss that second deadline? What happens?
So if you miss the second deadline, that's where we run into a little bit of trouble. Existing people, I'll say, could be stuck with their plan, and when we say stuck, if they've already got one, that's great, but it might not be the right fit for them for the next year, and they've lost the opportunity to make those changes. People that would have been new to the market, they could end up in a situation where they're uninsured until 2017, not able to purchase a plan, unless they have some of these special circumstances we call special enrollment periods. They're more the exception than the rule. Then the worst part of all this, besides you don't have the coverage, you're probably subject to a penalty, right? A tax penalty, because of this thing called the individual mandate.
All right, so let's first stop for a second and talk about, if you have a plan from last year, you can keep it. If you have no plan, you might be without one, unless there are these special enrollment reasons. So tell us about those.
So special enrollment period, again, they tend to, you can't make them happen, they tend to happen to you, right? So they would be things like, let's say you had a baby, or you got married, maybe you moved to a new area permanently. Could be you lost coverage through a job because you lost a job or that coverage. These are special enrollments. They'll let you purchase coverage throughout the year. But again, they're more the exception than they are the rule.
Okay, so what if we don't have a qualifying life event and we miss signing up for health insurance? Tell us more detail about this penalty.
Right, so the penalty has been a part of the ACA since the beginning. It started out small and it's continued to increase. In 2015, the penalty was $325 per uninsured adult, or 2% of the household income. In 2016, that's really escalated, $695 per uninsured adult, or 2.5% of the household income. So it's a double whammy. First, you don't have the coverage to protect yourself and your family. Second, you're paying a tax penalty.
Yeah, and you could have paid for the health insurance instead of paying for the tax penalty.
Exactly right.
And I know there's something called subsidies. So are subsidies still available?
They are available, and it's amazing. People are surprised to find out how many people are actually eligible for these subsidies. Both existing members, we encourage them to go back out and check to make sure they're getting the correct amount so they don't have any surprises at tax time, and that they get the amount that they deserve. And the individuals now shopping for coverage, they find out how much more affordable it can actually make the coverage.
So who qualifies for subsidies?
If you're your household income between 139% and 400% of the federal poverty level, there's a real good chance you're going to qualify for some sort of premium assistance.
Okay. Does everybody actually get those subsidies?
National numbers said as many as 9 million people last year actually could have qualified for some sort of subsidy and didn't. Some of those may have just paid the full freight of the coverage and didn't need to. Without knowing. Others probably went uninsured when they could have gotten the help. So it's real unfortunate, and that's why we say, talk to someone. You can visit healthcare.gov. You can use an independent insurance broker if you need to, or call Medical Mutual, or call whoever your insurance carrier is and ask for some help, right? You've got a website, you've got licensed sales agents available at our company that can help you make these decisions both on plan and to help find out whether you're subsidy eligible.
Yeah, you need this information.
Yep.
Health insurance coverage is so important for you and your family. Don't miss these upcoming deadlines and be punished with a penalty. Enroll now. And for help, use the information that's coming up next. My thanks to Doug for identifying these really important dates.
Find out more about Medical Mutual of Ohio by visiting their website, www.medmutual.com/2015 options, or call 1-866-488-3266.